Hey everyone, I'm Dr. Z. Welcome back to my channel. I am a clinical psychologist specializing working with transgender adults for the past 20 years. And today we're talking about something that doesn't get nearly enough attention. Gender dysphoria that emerges or becomes undeniable later in life, particularly after age 35. So if you're someone who didn't question your gender until 30s, 40s, 50s, or beyond, this video is for you. Because the experience of coming out later comes with unique assessment challenges, different clinical considerations, and questions that younger trans people might not face, but you, as a result of your age, actually do. And I want to be very clear from the very beginning. Coming out later does not make you any less valid, but it does create specific complexities that deserve very thoughtful exploration. And in this video, especially, I'm going to share with you 6 most common patterns of coming out later narrative that might explain to you why you became aware of your gender later in life. So watch out for those patterns and see if you can identify one, or most likely more than one, that resonates with your personal experiences. So let's go ahead and dive in. Coming out to understand your gender identity later in life is actually far more common than the dominant narrative suggests. And I know that today, a lot of people tend to still believe that coming out happens in childhood. And if you have not come out in childhood, or in other words, did not have early childhood onset gender dysphoria, then if you're coming out later in life, that somehow invalidates or somehow implies that your trans identity is not valid, is not real, that the dysphoria you're experiencing is not something to be taken seriously. But in my practice, and remember, I've been practicing for 20 years, that's 2 decades, I actually regularly work with people who, for example, didn't question their gender at all until their 30s or 40s or 50s or even 60s and 70s. I work with a lot of people who had very successful careers, had great marriages, have children, and yet still discovered they are transgender. I have a lot of people who maybe spent decades uncomfortable, but couldn't quite name and why. Or I worked with a lot of people who have experienced something that cracked open their gender questioning later in life. What we usually say, you act cracked. Something happened that pushed a lot of repressed content, a lot of feelings of denial to the top of the surface, and as a result, you become aware later in life. So yes, some trans people definitely knew from childhood, but many others definitely did not. And there are very specific reasons why gender dysphoria might not become conscious or undeniable until later in life. So let me share with you some of the most common situations why later life realization happens for so many adults. The most common reason for the older adults is lack of language or lack of awareness. For example, if you grew up without the concept of transgender even being accessible in a way of language, you wouldn't know how to make sense of your experience. You didn't know, for example, maybe that transition was even possible until internet, until there was increased visibility, and until social acceptance made the language finally available to you. You literally didn't have words that you needed to define what you were experiencing. The second most common reason is effective repression and compartmentalization. And my goodness, I work with so many adults who are incredibly skilled masters of repressing their gender identity, or being so good at compartmentalizing any form of discomfort they're feeling, to the point of not even perceiving it being there until one day the lid pops open and everything comes to the surface. So perhaps you were very good at pushing down your gender feelings. Or maybe you built a successful life without ignoring or a successful life while actually ignoring a fundamental part of yourself by paying attention on your work, becoming workaholic, and as a result, neglecting who you are. Or maybe survival required you to make it work in regards to discomfort you actually felt. And as a result, you had to become accustomed to your assigned gender. Or maybe you convince yourself that everyone feels the way you do and you should feel this way as well. These are some very common forms of not only denial, but also of repressing things and focusing on other external things around you. The third most common reason is life stage and safety consideration. And what I mean by that is, for example, um, maybe you couldn't afford tuition when you were building career or risking coming out to your kids or trying to survive financially. In other words, you just didn't have space, safety, resources accessible to you to focus on yourself. Maybe coming out earlier would have meant for you to really lose your family, livelihood, maybe even losing your community, and which still, by the way, rings true today. Maybe you needed stability before you could afford to step into transition. Or, and this happens a lot, safety to explore came to you later in life, meaning earlier in life, there was just absolutely impossible for you to even safely explore your identity because it was completely unsafe. But now, maybe later in life, you're finding yourself relocating, moving maybe to a country where you feel it is a little bit more safer to go there, to explore who you truly are. This is another very common one. Another common reason for late life awareness is gradual intensification of gender dysphoria over time, meaning your gender dysphoria got worse with age, got worse as you started hitting different age milestones, different developmental milestones. Maybe some of you um, became parents. That's a big milestone, and as a result, you experienced something that made gender dysphoria unbearable. Maybe you also experienced body changes. Um, Perhaps what was manageable as a discomfort in regard to dysphoria in your 20s suddenly became unbearable in your 40s. In other words, the coping techniques you used in your 20s became completely unusable in your 40s or later in life. Maybe also, and this is a common one, aging into the wrong gender became increasingly distressing. Or maybe you hit a breaking point where denial was no longer sustainable. This is another very common one. And other common reasons for late life awareness has to do with triggering life events. What I mean by that is you may have experienced a very big life transitional moment, a very big, devastating moment in your personal life that almost crumpled the exterior protective walls that you built around yourself due to denial, repression, maybe other factors, and suddenly burst gender awareness, your authentic sense of self forward. Some of the examples could be maybe it could be a death of a parent who you were really afraid might be disappointed. Um, the death of that parent might suddenly trigger awareness of your true self. Perhaps divorce or relationship endings that created space for you to explore who you are. Maybe your children suddenly grew up and left home, and now you found time to focus on yourself, to go inwards, to ask yourself all of those questions. Or maybe you had health scare. This is very common. Maybe you had some kind of health scare experience that made you confront mortality and as a result confront your own authenticity. This happens a lot. So if you had a very big life transition moment later in life that may have pushed you to confront things about yourself. So as you can see, there are many reasons why late onset of gender dysphoria happens. So I want you to trust me when I tell you, if you're discovering your gender identity at 35, 45, 55, 65, 75, or beyond, you're not too late. You're not less trans. Trust me, you're nowhere less trans, and you're definitely, definitely not alone. Now, let me go over those 6 patterns that I mentioned in the beginning of the video. These are going to be 6 most common patterns I see in my practice when working with people who come out later in life. So see if your personal experiences fit in any one or more of these patterns, which most likely are going to. Pattern number 1 is when a client has a narrative of, it's always been there, but I buried it. Now, usually this type of narrative, it's always been there, but I buried it, tends to present in this way. A person might have a clear childhood or adolescent memories of gender discomfort. They may have decades of pushing feelings down, dismissing them, or telling themselves that they're being practical. Oftentimes, these individuals experience increasingly unbearable dysphoria with age. And finally, something finally broke through denial. So this is a very common pattern where a person says, it's always been there, but I buried it. And usually denial or repression just stops working and busts experience forward. The second most common pattern that I see is when a client says, I thought everyone felt this way. This is often a way of normalizing your experiences to yourself by convincing yourself or believing yourself that what you're experiencing is very common. And as a way of telling yourself that, you kind of not only normalizing it for yourself, but you're preventing yourself from digging deeper into your authentic self. And the way this client often presents is usually they get a history of, I always felt different, but didn't really have language to describe it, or didn't have language to understand what about me was different. I assumed everyone was uncomfortable in their genders the same way I'm uncomfortable in my gender. Only recently I learned that's not a universal experience. And then these people usually have a very sudden realization. Oh, I'm trans. That explains everything. So if this sounds and resonates with you, you're most likely going to fall into this pattern. Pattern number 3 is when a client has a narrative of, this escalated gradually over time. And as you can already imagine, with this type of narrative, this escalated gradually over time. Usually, a client presentation or client history comes across as mild discomfort that usually people experience maybe in their youth that tended to intensify over age. So clearly, this is somebody who actually been aware of discomfort. So denial is not here, repression is not present, but you have been aware of it, but it has been so mild that you were able to tolerate it or convince yourself that you can tolerate it until it escalated it. And as you can imagine, this dysphoria that was tolerable became intolerable over time. Maybe even aging into wrong gender started to feel increasingly wrong for you as you started to age. And usually this type of client eventually hits a breaking point. So very, very, very common. Again, this is when a client knew, but they thought that they can tolerate it. With age, it became much more intolerable. Pattern number 4, when a client narrative is, a life event cracked me open. Also known, it's very common as, my ex suddenly cracked. With this type of narrative, a client often presents this history of life altering, life transitional event that usually led to awareness. And as I said earlier, this could be maybe a parent's death removed fear of disappointing them. Maybe divorce created space for this person to explore deeply. Maybe kids left home and now they started to focus on themselves. Healthcare made them confront mortality. Depression, denial busted the door open, no longer started working. For a lot of people during COVID, COVID was that life transitional event that force people to go inwards and to confront aspects of themselves. So this pattern of my egg finally cracked, a particular event suddenly busted everything open, is very, very common. Pattern number 5 is often seen with a narrative of almost like a very self-questioning narrative. Is this real or am I just unhappy? This is often presents in client histories at a point of life of transitions. Usually because there's a life transition and you're also questioning your gender identity, you start to wonder to what extent can actually be real. So the discomfort is not very strongly felt. And as a result, you wonder how much this other life event might be actually making you question your gender. For example, if you have midlife dissatisfaction with your career, marriage, or life purpose, and gender dysphoria coming to the surface, you may have a narrative of, is this real or am I just being unhappy? Um, maybe you started to have uncertainty about whether dysphoria is even real. Maybe you're worrying that you're trying to escape other problems by focusing on gender. This type of narratives that I see of, is this real or what, often comes for people who, again, don't feel a strong sense of dysphoria, but are slowly starting to question authenticity of their gender. And as a result, they also have parallel to that life event happening. Happens a lot of times. And finally, the 6th pattern, which is actually very, very common too, has a common narrative of, I came out as LGB first, now realizing its gender. And these clients often present this history of coming out as maybe gay, lesbian, or bi many years ago. They thought their sexual orientation explained their gender differences, and as a result, didn't really dig in deeper. But now they're realizing it was always about gender and not just about sexual orientation. And as a result, these clients often experience what I call two-stage coming out process. First, you come out with your sexual orientation, and then second, you come out with your gender. It's very, very common to come out first with sexual orientation, and as a result, again, to convince yourself that other gender issues you're feeling are maybe a byproduct of that confusion and not address it until later in life. So these are the most familiar 6 most common patterns of coming out later in life that I personally witness in my life. In my practice in 20 years of working with transgender adults. Um, so if you're realizing you are fitting into one or two or more of these patterns, that's very, very common. And if you're someone who is now watching this and for the first time coming to realize that your gender identity is coming to the surface right now, here's what I want you to know. Here's what I want you to know for everybody who's coming out or has already come out later in life. Because, first of all, it is so common. One of the things that I really want you all to know is that your timeline of coming out at 35, 45, 55, or yes, 75 and beyond doesn't make you any less trans. It makes you someone who figured it out when you were able to. That's all it does. The amount of adults that I work with who come out later in life is tremendous. They make up the bulk of my private practice. That just to show you how common it is. Now, if you're just realizing this or came out already later in life, I want you to also realize that the complexity of your situation doesn't invalidate you. Sure, your life is more complicated than a 20-year-old's, for sure, but that doesn't mean you shouldn't transition. It means your transition will look different, and that's okay. Oftentimes, people feel like that the complexity of where they are in life is somehow supposed to be a big stop sign that they cannot move forward. Meaning, a lot of adults come to me and say, well, I have a career, I have life, I have friends, I have community, I have all of this volunteering activities I do. All of them revolve around people relating to me and knowing me in my assigned gender. And if I were to come out now, well, that's very challenging. I potentially risk rocking the boat of my ecosystems that I have created. That's the complexity of coming out later in life that I'm talking about that is so, so common. But again, it doesn't mean you shouldn't transition. It doesn't mean you shouldn't confront who you are. It doesn't mean that, in the very least, you shouldn't take small steps to alleviating discomfort you feel. Again, all it means is that your transition will look different than somebody who is in their 20s, who hasn't built their life yet, who hasn't stepped into a relationship yet, who doesn't have a built career. But different doesn't mean that it's going to be more complicated or more challenging. It's just going to be different. Another thing that I want you to keep in mind is that good assessment with a good therapist is support. It is not a gatekeeping. A thoughtful therapist asking you questions is not trying to, when they dig deep, they're really not trying to talk you out of being transgender later in life. They're trying to understand your situation much more fully so they can support you well. That's what I do. I often ask people what their situations are like, what their circumstances like. I even ask people later in life, what are their current finances are like? Why? Because a realistic approach to their gender transition or whatever they decide to do is incredibly vital. So if your therapist is asking about your history, your motivations, your context, that's a good clinical care. Stick with them. Don't change your therapist if they dig deep. That's a good therapist. I want you to also remember that you deserve support that addresses all of you. If you have depression and dysphoria, it needs to be addressed both. If you're having a midlife crisis, for example, and you're transgender, you need to address both of them. If you have complex relationships and you need to transition, get support for navigating both of them. You're not just your gender identity. You're a whole person. Your identity doesn't just revolve around this particular aspect of who you are. It touches every other element of your life. So keep that in mind. I want you to also remember to be patient with yourself. You might need more time to assess and understand than someone younger with clearer narrative. Somebody who maybe no one since childhood and has a very strong pain point is going to have much more clarity about their identity than somebody like you who realized later in life, because the denial and repression and the way you used to cope with it suddenly stopped working, or maybe a big life altering event triggered you act to crack. You're going to need more time to understand why this is happening. And a good clinician should be able to explain to you why. When I work with clients, I make sure that I tell the client and explain, this is why, this is what I see, this is why you now feel the way you do, this is why it feels very confusing and overwhelming. Give yourself time and patience. Not everybody was aware in childhood, and many of you were aware in childhood, but you're not going to realize it until you can look back in your childhood and you can see the lens of discomfort, the experiences of discomfort you actually experience. I also want you to keep in mind that when you're going to look for a therapist, you really want to look for a therapist who not only affirms your identity, but also asks you thoughtful questions. Somebody who doesn't gatekeep you based on your age or timeline, but somebody who really understands complexities of your experiences and of your life, somebody who even have experience with later life transitions, and most importantly, somebody who can hold a nuance. There's a lot of therapists out there who think that transition is the only way forward. There's a lot of therapists who think that there's a certain way to do it. A really good nuanced therapist is somebody, again, who situates whatever it is possible decide within subjectivity of your life, within the experiences of your life. Because if it's not situated within your life, it's not going to work. Your transition, remember, can still be beautiful. Some of the most profound, some of the most amazing transitions I have personally witnessed have been people in their 40s, 50s, 60s, even 70s who finally gave themselves permission to live authentically. And yes, a lot of people don't decide or feel like it's not worth it to go through maybe gender affirming surgeries or even hormones, but there's still so many other steps that you can make to get much more in touch with your authentic self, to allow yourself to express your authentic self. Later doesn't mean less meaningful. Let me say that again. Later does not mean any less meaningful. Often, actually, in my experience, it means more. It is much more rich and reaching and much more meaningful because you know what you're choosing and you know why, and you know yourself so much more. You're also much more mature in your older age to deal with complexities, to deal with challenges of life because you have dealt with life already. And as a result, you're that much more better equipped. So if you're 35, 45, 55, 65, or beyond, and you're just now figuring out your trans, welcome. You're not too late. You're not less valid. You're not trans. You're exactly where you need to be. You're right on time for your personal life path. And there's definitely support available to help you navigate the complexity of wisdom, navigate the complexity of situation with so much compassion and so much grace. So keep that in mind. And if you're watching this, comment below, share your experiences. If you find this video resonated with you, please make sure you like, you subscribe to this video, share it with somebody who needs it. Resources also on how to book a free 15-minute phone consult with me are down below. Also my workshops, there's a Let It Bloom beautiful workshop available to you in description box below. So comment below, share your experiences. Drop your age, at what age you became aware. Drop your age, at what age you started to transition. Let's uplift other people who feel that later in life is too late. And I cannot say this enough, people. There's no such thing as too late. In life, you're not going to regret. You're not going to regret what you did do. You're going to regret what you did not do. So take care of yourself, and I will see you all in the next video. Goodbye.